Good afternoon and welcome to the BBC News at 1. It's been called the worst treatment scandal in the history of the NHS. And today a public inquiry gets underway into how thousands of haemophiliacs were infected with hepatitis C and HIV during NHS treatment in the 1970s and 80s. Richard Lister reports.
When they told me what they'd done to me, I stood at a motorway bridge to jump off it.
I feel we've been treated very badly. Nobody's listened to us over the years.
Successive governments have failed to live up to their responsibility of what they've done to us, of what they've done to my family and what they've done to my life.
Just some of the victims of the biggest medical disaster in NHS history, telling their stories on video at the start of the inquiry last year. Now it begins its next phase, to understand the impact of this tragedy and how it happened.
Although it will never be possible to hear orally from everyone who would wish to be heard, those affected and infected will come first and last in the inquiry.
In the 1970s and 80s, the NHS imported blood products from the United States. Some were made with donated blood from prisoners and even drug addicts at high risk of carrying viruses. No one knows how many patients the NHS treated with infected blood. Estimates suggest around 5,000 were treated for haemophilia and other diseases. But there could be as many as 30,000 others who received blood transfusions contaminated with hepatitis and HIV.
I do solemnly, sincerely.
Derek Martindale was the first to give evidence today. He recalled finding out he'd been infected with HIV at the age of 23.
I went at lunchtime to get the results and I was told that I was HIV positive. I was told I had about a year to live. I was told not to tell anybody, including my family and my parents.
The inquiry team have scanned the country for official files. There are millions of documents to be reviewed in the search for answers. Not least to the question, was there a cover-up?
Documents have been destroyed, we know that for certain, and so there's a question of how much we will be able to reveal. But for the first time, this inquiry actually has teeth. It's a statutory inquiry. It will be able to summons witnesses and compel people to produce evidence, which is hugely important.
The road to justice has been a long one. Those affected have been demanding this inquiry for decades, and it's likely to take several years to complete. The campaigners say another victim dies from infected blood every 4 days. Richard Lister, BBC News.
Well, let's speak now to our health correspondent Sophie Hutchinson, who's at that inquiry for us. Raw emotion on show today, particularly given the length of time this inquiry has taken.
Well, absolutely. This is a hugely significant day for the victims of this scandal and their loved ones. Some have waited almost 30 years or more for a public inquiry to come. It is their first chance to tell their stories, give their accounts and have them put on official record of just how much they have suffered. And their evidence is, as the chair, Sir Brian LANGSTAFF, said today, harrowing and incredibly moving. He also described some of the accounts as chilling. It's the start of what's expected to be 11 weeks of evidence between now and October. Each day we'll see around 3 witnesses give their testimonies. And today we've already heard from 2 witnesses about the distress caused by being infected, about doctors telling them to keep their infections a secret, being told they only had a year left to live, about the suffering of the symptoms of hepatitis and HIV. This is hard evidence to hear, but so much harder for those caught up in what's believed to be the worst scandal in NHS history for treatment.
Sophie Hutchinson, thank you very much.